Hello, I have made a brochure on lymphedema, and I'm going to take some time to walk through the information contained within this brochure itself. Right off the bat, you can see that lymphedema is an accumulation of fluid flowing improperly due to complications within the lymph system. This packet will also have the stages of lymphedema, some signs and symptoms, the pathogenesis, along with the causes of it, also some medical management and reasons that physical therapy can help either prevent or slow the progression of lymphedema. When you open up the packet right away, you will see on these first two pages that you have your signs and symptoms, what happens, which is the pathogenesis of lymphedema, along with how you contract it or the cause of it. The causes of lymphedema, there are two different causes. The primary cause is unknown. The best knowledge of it is that it happens in adolescence and midlife, and that women are at greater risk than men. As for the secondary cause of lymphedema, it is acquired, typically through benign or malignant neoplasm, lymph node dissection or removal through surgery, and that this type of lymphedema here can really occur, days, weeks, months, or even years. Moving over to this side with the signs and symptoms, you will have early signs and symptoms of numbness, burning, aching pain, maybe some skin tightness, heavy limbs, maybe some swelling, which will decrease your range of motion through your joints. If your lymphedema progresses, then you will have an increase in limb girth, maybe some postural changes, or even some increases in neurological signs, changes in the skin. Moving down as through the pathogenesis, which is really what's going on and how this came about, is that you have fluid volume in the affected area is normal, but the transport capacity is impaired. So the fluid is not able to move to the next distant site properly. When you open to the next couple of pages, you will see that you have the different stages of lymphedema in the middle, followed by the medical management and how physical therapy can help. For the stages, there are 4 different stages. Stage 0 is really the best stage for physical therapists to help out because it is subclinical. You don't have an edema present, so you'd look for some pain or some aching in any possible affected areas. As for stage 1, you're going to see chronic inflammation starting, and you're going to have edema that pits, which is it can be poked and it will stay indented. As for stage 2, you're going to see skin fibrosis and scarring, which is going to be the hallmark sign that you definitely have lymphedema and you are definitely in stage 2. Also, the edema will be difficult to pit, and swelling can occur along with some major skin changes. As for stage 3, you're going to have protein-rich edema increases along with fibrosis increases, and the edema does not pit, and you may have some skin folds and hardening dermal tissue. Moving to the medical management, drugs have very little evidence, but some drugs that could be used to help lyse the proteins and help reabsorb the fluid back into the lymph system. You're going to want to avoid diuretics because losing water will make the situation worse. NSAIDs or non-steroidal anti-inflammatory drugs will worsen as well, and there are also surgical procedures that can be done. Lastly, for why physical therapy is important is they can teach you about the signs and symptoms so that you are not too late. They can also help prevent progression to the next stage, manual lymph draining technique, along with compression, bandaging, and garments, or even a compression pump. Hopefully this helps. If you have any signs or symptoms, please call your primary healthcare provider. Have a great one.